There's a tour that could be heading your way. Sorry, it's not headlined by your favorite artist. It's a tour filled with information about the benefits of the American Rescue Plan Act. It's called the Affordability Tour. And to share more about this important event is Reverend Ferrell Malone, founder F.R.E.S.H, who is on the road right now. Hi there, Reverend.
Good morning. How are you doing?
I am doing great. So tell us all about this tour. It sounds so needed and so wonderful. What a great idea.
Well, we did a tour earlier in the year during the summer months. It's called the 3V Tour, Voters, Vaccine, and Vision. And we talked about the American Rescue Plan. We talked about how communities can actually access the funding of the American Rescue Plan. This particular F.R.E.S.H affordability tour, we're particularly concentrating on the Affordable Care Act, what we know as Obamacare. I am the regional health consultant for 8 southern states: Louisiana, Mississippi, Alabama, Northern Florida, Georgia, South Carolina, North Carolina, and Virginia. And we're with F.R.E.S.H communities. F.R.E.S.H is the facilitating restoration for equitable and sustainable health in communities. And we are working with IMS, and which is Integrated Management Strategies, and CMS, Center for Medicare and Medicaid Services, to put boots on the ground so that we can go into each community and let people know the awesome benefits that are available through the Affordable Care Act. Because of the American Rescue Plan, the Affordable Care Act has been shored up. And so actually, because of that new law, 4 out of 5 customers will be able to get coverage for $10 or less per month. That is phenomenal. People also who went and tried years earlier can go back now because of the shoring up of the Affordable Care Act. Subsidies are higher, premiums are lower, some are zero. I often tell folk, my son, who is married and has 2 children, we wrote him up last June. His premium for major medical and hearing and dental was $35.98. When we certified him for January 1, his premium is 0. What we need to do is get it into the hearts, into the lives of our people, that they can afford this insurance, because they need to go and make sure it happens.
Oh my goodness, that sounds good to me. I mean, that's incredible. We've come a long way since people going into the plan and saying, oh my God, everything is so expensive, I can't afford anything. They need to know. No, maybe look again, because it looks like we have additional funding and you'll be able to have a pleasant surprise, it looks like.
Yes. What we're doing now is we started here in Waycross yesterday. We were in Brunswick, Georgia, and Savannah, Georgia today. We'll be in Charleston, South Carolina, Columbia, South Carolina on tomorrow. Then we will be in Macon, Georgia, and Atlanta, Georgia on Wednesday, Birmingham, Alabama, and Montgomery, Alabama on Thursday, Mobile, Alabama, and Pensacola, Florida on Friday, and on Saturday, Tallahassee, Florida, Tifton, Georgia, and Albany, Georgia. We are ultimately excited about boots on the ground, getting the word out to the people in our community to let them know that they need to apply. Open enrollment is November 1st, generally to December 15th. It has been extended to January 15th. So anybody who gets enrolled by December 15th, they will be able to have their coverage start on January 1st. People who are in by January 15th, their coverage starts on February 1st. But we want to make sure they go in and get it in. While we're on our tour, not only are we sharing information, but we have federal navigators and assisters who are assisting and helping to get people enrolled. If they can't get enrolled on site, they're going to follow up with them to make sure they get enrolled. The numbers are up because we need people to get this insurance to help cut down the health disparity, make sure you can do preventive care and not have to go to the hospital, to the emergency room, and into ICU because we waited too long because we didn't have the coverage.
You know, I'm so glad that you reiterated when the enrollment deadlines were, because I had heard a lot of messaging around December 15th, but I haven't heard a lot of messaging around the fact that it's actually been extended to January 15th. So if you've already gotten it, wonderful, you're good to go come January 1, but you still have time to go in there, do your research, make a good plan for you, because if you need a little bit beyond Wednesday or so of this week, you have that extra time now.
No doubt about it. January 15th. We want to get people in as soon as we can because we know there's going to be a rush at the end. Yeah. So you can now go www.healthcare.gov and get directly into the program now. Or you can use the opportunity to bless and have your church involved in it. They can go to cms.gov and become a champion for coverage so that they can get the information by which they can do it at their church, at their community club. Whatever we need to do in the community to get it to our people, we need to do it.
I love it. And I love so much what you are doing specifically, because there are people that may be feeling a little intimidated about going online. Maybe they're not used to doing that. Maybe they don't know where to go. Maybe they don't have broadband. You know, people have different, especially in the South. I know I'm from a very rural area. You cannot buy good internet access where I'm from. So the fact that you are actually going to where the people need to hear from people like you directly, I think is amazing.
Well, let me let you know what else we have. We not only do we have my bus, which is right behind me, but we have the Fort Valley State University, an HBCU. They have a mobile tractor trailer, a mobile technology center that has 20 computers on it. That bus is accompanying us as well. So when you get there tomorrow or whenever we come to your community, not only will we be able to sign you up, but we'll be able to put you on this tractor trailer, and the navigator broadband is on the actual vehicle itself. It is an awesome innovation in technology. We're taking it to the heart of our communities to make sure our people get covered.
I love it. So tell us once again how people can find out about you and your schedule so they can know when you're coming to their town.
Yes, they can go to ourfreshcommunities.com. Ourfreshcommunities.com. Our schedule is there. And also the information on what they can do to text, and we can give information to them. All of that is in place right now.
That is wonderful. Congratulations for all that you're doing right now. Thank you for all the work that you're doing in the community. And we look forward to seeing you out there on the road.
Thank you. God bless.
Back to that Roland Martin Untitled video in just one moment.
Time to be smart.
Roland Martin's doing this every day.
Oh, no punching!
Thank you, Roland Martin, for always giving voice to the issues.
Look for Roland Martin in the whirlwind, to quote Marcus Garvey again.
The video looks phenomenal, so I'm really excited to see it on my big screen.
Support this man, Black Media. He makes sure that our stories are told.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
I got to defer to the brilliance of Dr. Carr and to the brilliance of the Black Star Network.
I am Roland with Roland all the way.
Honored to be on a show that you own. A black man owns the show.
Folks, Black Star Network is here.
I'm real revolutionary right now. Roland was amazing on there.
Stay black. I love y'all.
I can't commend you enough about this platform that you've created for us to be able to share who we are, what we're doing in the world, and the impact that we're having.
Let's be smart. Bring your eyeballs home.
You can't be Black-owned media and be scared. You dig?